Good morning and welcome back to GP Video Podcast by Nadia. So today our topic is CT coronary angiogram. I'm sure you guys all have heard about coronary angiogram. Coronary angiogram is a traditional procedure that is performed on the patients in the hospital in a cardiac care unit, where we are looking for any blockages in the coronary arteries. What is coronary artery? A coronary artery is an artery which supplies heart. So whenever there are blockages in the coronary arteries, that's when patients get angina or chest pains or heart attacks or myocardial infarction. So in such patients who are having chest pains and we are suspecting that they have a cardiac chest pain or a heart sounding like chest pain, we do coronary angiograms in the hospital, where we look. What happens is, usually through the radial artery or the radial pulse, a wire or tube is passed that and then we inject the dyes that goes in the coronary arteries, and that shows, the x-ray machines are used that show that whether there are any blockages or not. That is also called as cardiac catheterization or coronary angiogram. Nowadays, according to the new technique, I think it's been there for around 10 years, if not less, there is a CT coronary angiogram. So in which way? So coronary angiogram, the actual coronary angiogram is invasive, in which we put a wire or a tube through the artery of a human being, and then we inject the dye, and then we use the x-ray machine to take the pictures. But in CT coronary angiogram, what happens is we place a cannula in the vein, and then we inject a dye that still goes in the coronary arteries, and through a CT machine or computed tomography machine, we take the pictures of the coronary arteries and see if there are any blockages or not, or if there are any irregularities or blockages involving the arteries. So this scan is not performed in a hospital. It is performed in a diagnostic center, where just a CT scan is performed, a cannula is placed in the vein, and then a dye is injected, and then we tend to find out whether there are any blockages in the arteries. And if we find out there are any there are any stenosis or narrowing of the arteries, or there are any blockages present in the artery, then we send them for an actual angiogram, in which we place the wire, and then if there are any other steps to be taken, whether the arteries need to be dilated, there are stents to be placed, or there are any other procedures to be done. So CT coronary angiogram is actually a very, very good non-invasive procedure to find out whether there are any blockages or not. There is another procedure that is usually sometimes combined with that, and that is called calcium scoring. So that is also a CT calcium scoring, but basically what it looks at, it looks at the outside of the coronary arteries to see whether there are any calcium plaques in there, and then the calcium scoring is done. But that is not as specific and sensitive as the CT coronary angiogram is, which looks in the inside of the arteries and sees whether there are any blockages, any plaques, or any irregularities, and whether we should be going further ahead and removing those plaques, putting the stents in, or doing other cardiac procedures. So this is a very, very good new cardiac evaluation procedure or new cardiac scanning procedure, which is non-invasive, because previously it used to, when you have to do any invasive procedure that actually involves a lot of effort, you have to go and be admitted in the hospital, get the procedure done under these special circumstances. And this is an invasive procedure, so it has all the side effects and cons of the invasive procedure. But this one is purely non-invasive. Just putting a cannula in, injecting the dye in. Yes, it is contraindicated for people who are allergic to dye, or whose kidney function is not that good to have the dye. All the normal contraindications to the normal CT scans that we get with the dye. And CT scans are, as you know, are very, very common. You get it for tummy pain or for other areas. Like CT scans are done all over the body, and usually they can be done without the dye or with the dye. So with the dye, if you have any contraindications, special ones being the the big ones being allergic to the dye contrast or the contrast material, or having poor kidney function that you cannot have the dye in. These are the main contraindications. There could be other contraindications as well, but relatively it is a non-invasive procedure and very, very safe and very, very easy to do. GPs can prescribe it in Australia, but the problem goes around pricing of it. But while the specialists, when they prescribe it, that is the cardiologist, then usually they can be bulk billed. So that was all about CT coronary angiogram today. People in Pakistan can let me know whether this is, I don't think it's still in Pakistan, but let me know whether this has been introduced yet or not. See you next time.